When we say predictive health or predictive medicine, it's more about rather than getting to the stage when you act reactively, you treat the symptoms or you treat any of the condition before it occurs. My name is Arshad Farhad, and currently I'm working for Dell Technologies, and I look after the healthcare business in the Europe, Middle East, and Africa. I'm working there as a chief technology officer for healthcare, and also I lead a healthcare vertical practice in the same region, which is Europe, Middle East, and Africa. And prior to joining Dell, I worked in the National Health Services, which is NHS. If you're a UK listener, then obviously you're very familiar with that. I've worked with NHS for nearly 13 years at various leadership roles, such as CTOs, CIOs. I'm a computer system engineer by trade. So I've studied computer engineering right from my after leaving my college. So as you may have gathered now, I've been working in the healthcare for nearly good 20 years, and sole reason for that is look, I'm very passionate about healthcare, right? Because it's one of the profession I think where you can see the impact on people's individuals' life when you do some projects. For example, if you're doing some, I don't know, radiology solution, you can see the improvement. And at the end of the day, any of these improvement will result in savings life or improving patient care, right? So that's what I'm passionate about. So, and obviously that's what I've been working in my professional career. And my PhD is or research is based upon the same obviously healthcare, which is how to use data sciences and artificial intelligence on IoT data, which is coming from medical devices. So, for the listeners, again, in IoT, which is Internet of Things, but when you apply the concept on medical devices, such as your Fitbit, could be IoT device, or number of thousands of medical sensors, then we call them as IoMT, which is Internet of Medical Things, right? So more
Right.
specific to the medical devices. So my research or my PhD is undergoing at the moment and is based upon how to use data sciences, basically how to use data which is coming from these medical sensors devices, IoT devices, to improve patients' care, right? So again, it's a journey. Obviously, as you know, I'm full-time working.
Mm.
I've nearly done half of it, but obviously still about three years left to go. So it's a very niche area at the moment, right? There are a
Yeah.
lot of challenges. There are a lot of huge potential, but at the same time, there are a lot of challenges as well, right? So working through the academia, such as how we're gonna address those challenges, and then hopefully eventually, once they have been sort of in some productive market, then we're going to bring them into market as well. So it's a mix of both, and I'm really excited what's going to come out at the end of this.
Can you tell me about something that sort of you're excited about in the healthcare space involving IoT and analytics and how this can potentially save lives?
In fact, before I answer that, I think I would probably spend a minute or so in talking about where the healthcare or technology is going in healthcare, right? A
Sure.
lot of things what we are doing currently at the moment, they are all more of reactive based treatment we are doing at the moment, right? So you get symptoms, you go to see your doctors, and doctor prescribe a medicine or some treatment. So these are more reactive to what happens to your body, and then you go and get treated, right? The world of health is more moving into predictive medicine or predictive health. When we say predictive health or predictive medicine, it's more about rather than getting to the stage when you act reactively, you treat the symptoms or you treat any of the condition before it occurs. So that's why we calling it predictive medicine or predictive diagnostic. So this is where the world is going. We're not there yet, right? And obviously, it's not going to happen overnight. It's a journey again. And when I'm saying predictive, don't think, Gareth, that is going to be 50 years from now where we are, right? I'm
Mm.
talking probably 5 to 10 years. Obviously, different countries are at different level of health tech maturity. So some countries it may come in the next 5 years, and in some countries it may come in the 10 years, right? But eventually, this is what's going to happen. So where we live at the moment, or the world we live in, is more of reactive world in terms of healthcare, right? We go and see our doctors or GPs or hospital or A&E. when we have some symptoms, right? So before something happens, before maybe a pain start, before maybe something start to happen in your body, the technology or the data which we'll be collecting from the human body, with the help from different sensors, and IoT is one part of that jigsaw puzzle, right? Because when we start collecting the data, and that would be we're going to call the data-driven healthcare, right? So your healthcare is more driven by the data that we are collecting from your ecosystem of your body, right? Because obviously your body is comprised of thousands of different organs and all those sort of things, right? So in the predictive health, the one of the most important thing is obviously, first of all, we got to have some sort of, you may have heard the word the genome sequencing. So these days you go online, you try to look for your DNA profile. So that's just again one part of predictive health.